My name is Yanink Caro. I came from Mexico City. I'm a researcher there in the Instituto Nacional de Ciencias Médicas y Nutrición Salvador Subirán. On behalf of my colleagues, I want to show the results of our study, sex disparities in geriatric syndromes among people 50 years or older receiving care for HIV infection in Mexico during 2012 to 2017. I'm sorry, I don't know how to pass to the next. Here. Yeah? Oh, sorry. Yeah, okay. Well, many studies have shown that HIV infection accelerates aging, leading to early development of age-related conditions. For example, for cardiovascular and neurocognitive conditions, it has found that HIV people has increasing rate. Also, with the WIS and MAX cohort, it was documented that women have higher number of non-AIDS comorbidities than men, regardless HIV and age. HIV-aged population has increased in Latin America. In Casanet, for example, we made this study in 2000, and we found less than 10% of people with HIV older than 50, and the number increased to 20% in 2015. Later, in 2019, Amy Justice found a median age for Latin America of 42 years of people living with HIV. Finally, limited data exists on comorbidities and geriatric syndromes, especially among women. Here are two studies with small sizes and some particular sites. So, sorry, next. Here. No. I'm sorry. This one? I'm sorry. To the objective, please. Is before. Yeah. Yeah.
It's just this button.
Okay. Thank you. Okay. The objective of our study was to estimate the frequency of non-communicable diseases and geriatric syndromes and explore their associated characteristics among older women and men receiving HIV care in Mexico. We conducted a cross-sectional study including Mexican people older than 50 years during 2012 to 2017, and we decide to evaluate these conditions: falls, non-communicable diseases, neurocognitive disorders, and other mental health, disabilities, frailty, hearing and visual impairment, frailty, and polypharmacy. And we use those scales and instruments. For disability, there are 3. For activity, daily living, instrumental, and mobility disability. For mental health, we choose geriatric depression scale, generalized anxiety disorder, and for neurocognitive, we use the anti-Nori criteria. We define frailty using the Fred phenotype and polypharmacy with 5 or more drugs, including antiretroviral. I think it's important to know a few of the HIV epidemic in Mexico, and I want to tell you that it's a heterogeneous country in the epidemic and also in the care, especially concentrated in MSM, and for 2023, more than 128,000 persons were reported on ART, 10% of them older than 50, and 20% of them women. Also, I want to tell you the origin of the study. In CENSIDA, which is the institution who coordinates the response of HIV care in our country, wants to publish a guideline for older people. So they look for us and a team of geriatric and infectious diseases and me, I'm sorry, I'm a statistician, conduct this study. And we evaluated in some people in the blue states. The blue states represents more than 35% of the epidemic in Mexico, but they have special characteristics. You see Mexico City, for example. In that place, the ratio of men to women is 9 to 1. It means that there are 9 men for 1 woman with HIV, but in other states, like in Guanajuato, is 4 to 1. And in the poorest and marginated states that you can see in yellow, like Chiapas, Oaxaca, and Guerrero, is 3 to 1. Unfortunately, we couldn't include those studies. But the outcomes we choose is the prevalence of each syndrome and non-communicable diseases by sex, and we fit multivariate logistic models to identify the association of sex with the presence of NCDs and geriatric syndromes. These are the conditions we choose to model: frailty, any non-communicable disease, falls, and depression. And the independent variables that we use: sex, current age, classified in these 3 categories, current CD4 count, below and above of 200, and education level in this way. We included 616 participants, 114 of them women. It means 18.5% of the study population. Women were older than men. The median age was 57. They were lower educational level. The median scholar level was 6 years for women, which is basically primary. And they were a similar CD4 counts and viral suppression status than men. But again, the overweight and obesity was more prevalent in women. In this plot, you can see purple for women, green for men, and in the italics and in blue, the significant differences for each of the conditions that are evaluating here. So women had a higher prevalence of hypertension, osteoporosis, and also when we summarize all these conditions in the last bar, it represents a women has 70% more than any of the non-communicable diseases we included than men. In this plot, you can see the frequency and the prevalence of geriatric syndromes we are evaluating. In the vertical axis is the total frequency, and the size of the ball represents the prevalence of the geriatric syndrome. For example, for frailty, you can see they are in the similar level. They have the same frequency, but the frailty is more prevalent in women. It's almost 10% versus 3% in men. Also, we can see women have a higher prevalence of falls, of neurocognitive disorder, and also for depressive symptoms. It doesn't happen for polypharmacy or auditive impairment. Here in disabilities, we decide to include the group of age, and we can see differences. In the first one, the instrumental activities disability, it refers to the use of instruments like the phone or making, baking, or transportation. Women have a higher prevalence of disability in the oldest group of age, the more than 70 years old. When we see mobility and disability, it changed, and now men had a higher mobility disability, also in the first group, in the oldest. For activities of daily living, which includes activities like dressing or eating by themselves, the percentage is higher also in men. In this, which are the adjusted models, we can see that women were associated in all the syndromes and conditions that we are including. The risk is higher for frailty, for falls, any non-communicable diseases, and depression in women. It's almost 5 times frailty in women than in men. Age was also associated with frailty and any non-communicable diseases, and we can see that older age is associated with higher risk of frailty and any non-communicable diseases. For people with a CD4 count lower than 200, we see also a higher risk of frailty and any non-communicable disease. Finally, educational level was only associated to any non-communicable disease. In conclusion, in Mexico, we found that older women living with HIV experience a high prevalence of non-communicable disorders and geriatric syndromes. Overweight, obesity, falls, comorbidity, depression, frailty, and disability disproportionately affect women. Being women was associated to a higher risk of frailty, falls, NCDs, and depression, independently of age, current CD4 counts, and education level. And that's it. I want to acknowledge all the patients participating in the study, the staff from the HIV clinics and all the cities, and Cecilia. Many thanks. I'll be happy to answer any question you have. Thank you.